My role now is to keep us, getting excited to continue the momentum that was kind of started with a small group, grew to this executive committee. And I want to say that, my energy came when many years ago, when I was a much younger man in those early years of caring for people with HIV in the 1980s. And over again, I'd be in a patient room and a doctor, a nurse, somebody would walk in and say, there is nothing more we can do. And I have made it my life goal and life mission to eliminate those words from every healthcare provider's vocabulary. And now, especially when we look at people as Joan beautifully described in humanitarian settings, there is something more we can do. And especially there's things we can do to address spiritual distress, psychosocial pain. We have good evidence-based ways of providing spiritual first aid, psychosocial first aid. So next slide. That was my advertisement. You've met some of our board, or not the board, but our executive committee, and Joan, who has been working in palliative care as a nurse, and Megan as a pediatric specialist. Next slide. Catherine, who you just heard speak as kind of combining palliative care and the humanitarian. Moira, who has been, a specialist physician in the UK for over 30 years in palliative care, and also her work in humanitarian situations. And now you've met myself as a board certified chaplain in palliative care and also a clinical social worker. Next slide. So what I want to talk a little bit to excite you, how can we build up this momentum of PallCHASE? And our ambition is we want to see a world where everyone affected by any humanitarian situation or emergency who's experiencing that health-related suffering has access to palliative care, so that if it's a refugee camp, a disaster setting, no health worker ever has to say, I'm sorry, there's nothing more we can do. There is always something more we can do. Next slide. So people were asking, well, what is this? Are we going to do direct service? Well, some of us are doing direct service, but we want to create a network, an effective network, where we advocate, we're a loud voice for the integration of palliative care in these situations. And as some of your questions said, this means advocating, educating, talking with governments, non-governmental organizations, whoever is in these settings. We also want to support the development of standards and policy, and a couple of those have been developed by, and endorsed by the WHO and Sphere. But we want to produce high quality evidence for what we're doing. And another value is that we want the participation and the engagement of those affected communities and individuals. So we kind of borrow, I'm mainly involved in the HIV, nothing, for us without us. And we keep that value when we're working in communities, providing and enable those opportunities for training. Next slide. So we absolutely believe in this dignity and inherent humanity of every person that's affected by an emergency, a humanitarian situation. And along with our other global partners, with WHPCA, with the University of Edinburgh, with the European Association of Palliative Care, that palliative care is an essential component of the right to health. And oftentimes I got involved with PallCHASE because in my work, refugees, migrants, those in disaster situations often have no voice. And so we want to give those people their voice and also empower ourselves that have big mouths like Father Rick to go to the WHO and go to these major unilaterals to advocate for people who have no voice. That palliative care is essential. It's not an add-on, and it's holistic. We want to make sure that all clinicians can care for the physical, the social, the emotional, and the spiritual, and that we have impeccable assessment, diagnosis, and care for all sources of pain. We want to work in genuine partnerships, and again, including those infected communities. Next slide. So we want to build, we keep using this word network, that PallCHASE wants to be a network where we have mutual learning that we had a beautiful taste of, in the first hour, that are inclusive and supportive. And how can we link and share information? What we discovered as the exec committee, there's lots of individuals doing some things. How do we bring these together and disseminate this information? So to exchange that knowledge, capacity building by listening especially to the people that we have the honor to serve, who have life-limiting illness, and showcasing those best practices and using Liz and the resources at University of Edinburgh that we have evidence-based practices. We're committed to addressing all of the discrimination and injustices that often arise in these humanitarian situations. And we are holding ourselves accountable to the highest ethical standard for ourselves and anybody that's working with us, so that we have the full participation of the communities that we want to honor and work with. Next slide. So we're going to share these slides, but just so that you have in your head, so that we can open this up to a more discussion with you, who I hope you'll become part of this movement, part of this organization, that we want to build an effective stakeholder community. We want you part of us. Some of you can spend more time, some of you a little time, some of you we support in the work you're doing in this field. But to engage and maintain communication with you through newsletters, webinars, blog posts, using the social media that we have available to continue to advocate. And again, working with our other partners, that we want to be that voice that, as IHP, the International Children's Hospice and Palliative Care did so beautifully with children. What about the children when we were advocating? Well, we want to be that voice that says, but what about people in humanitarian crises and disasters? Who is providing their palliative care? And to be that voice. Both at different international events, the World Hospice Day, that we're the voice for those people that may have no other voice. Next slide. We want to ensure that PallCHASE is visible, effective, and sustainable. And there was a question in the chat about, well, who's going to finance you? I have no idea. We're starting and we're operating on a shoestring, but we're doing, my daddy always said, do the right thing and the money will come. And so this is the right thing. And we're going to develop this and figure out how we can be sustainable, that we can map active, programs that are going on, that we can respond to questions as they come. Again, PallCHASE seeing itself as network and linking people that have these values, inviting others to come with us and share those good evidence-based practices. Next slide, Megan. You're right. I know my time's getting out. We see ourselves advocating, advocacy, advocacy, advocacy. And as the questions came in governments, and this is a huge challenge because many governments, we're seeing this right now, many governments don't want to provide any health services for non-documented, refugees and migrants. We want to work with our non-governmental partners. We want to be that voice in Geneva with the multilateral organizations, all healthcare systems, in humanitarian, palliative care sectors, the faith-based sectors that are doing so much work in this area, that we want to say, hey, don't forget, palliative care must be an essential component of healthcare provision. Next slide. We want to create this platform, and we're starting this now, with definitely a Facebook, Twitter sites, but that we can create a platform to exchange this information, building a website so that somebody that says, hey, I'm all of a sudden working, with this, new disaster situation, what can I do to provide spiritual distress first aid? What can I do to provide pain relief, physical pain relief in these settings? So we want to, again, exchange that information. Next slide. And support the development. This is so important, and you mentioned this, it was a great question. How do we convince other physicians, other healthcare workers, other chaplains and social workers that don't understand palliative care? Well, why would you, because I hear this all the time, why would you want to waste your time with those, they're going to die anyways? Well, we do that by creating robust, high quality evidence base. This is why we're doing it. Not only for the ethical values of compassion and human dignity, but because this is the best way to do healthcare. As Stephen was saying, we want to integrate this palliative care paradigm into all areas of healthcare and serve as a body that can provide this evidence, with universities, with those of us involved in research, that we contribute to the evidence base as well as building capacity. Next slide. And as you see, we are developing some major partnerships. Thank you to Liz that we're kind of hosted. We're sitting right now at the Global Health Academy in the University of Edinburgh. This is established. The next slide. And also working to see how we can be our voice with the Worldwide Hospice and Palliative Care Alliance that Stephen just mentioned. That this is already an existing great network that does training and advocacy, that we become part of the voice of those in humanitarian situations. And I think my time is out, and I'll end my sermon for now. Thank you.
Thank you. I know we're just bursting with things to say. One of the things that strikes me as somebody who's been part of these discussions is that that's a big task, isn't it? So we're really going to move now into more practicalities. Please don't, please keep all your suggestions and ideas. We really want to have people sharing. This executive group grew out of an open meeting to see how we could move forward as a network. And this is our chance to share that with that wider network and with those who haven't been involved before, to see how we can move forward on this pretty impressive vision and purpose. Megan, who's a pediatric palliative care physician in Ottawa, and who's also our technical support for all of this. And thank you also to Chuck in the background. And she's reminding us of the Twitter feeds and the social media. So please do that. I should have reminded people before. Megan, over to you to describe the working group.
Thank you, Moira. And I'm very pleased to be with you all today. And it's nice to hear and build on everyone else's comments. So I'm going to describe what we're actually going to do. The work that we have so far made a plan for based on everything Rick has described about what we think is the vision and the mission and the things that PallCHASE can accomplish. And it's still a work in progress, which is why we're sharing it with you for input, because we don't want to just say this is our idea, but it's an idea that we're sharing with you as a starting point. But we wanted to give some concrete idea of the things that we think we can work on together over the next few months and years. So what we've done is develop 6 working groups. And I'll tell you about them and what those groups will do and how they will focus. But again, within those groups, there's a lot of flexibility for the people who join those groups, which is all of you that we want to invite to join up with us to do the work, to decide what you want to do. So like I said, there's 6 and they're based on these strategic areas and priorities that we have identified thus far. But this isn't to say that we wouldn't develop more working groups based on the interest of all the members of PallCHASE and guided by developments in our strategic plan. In terms of just really the practicalities of it, we expect that the working groups, the commitment would be about 1 to 3 hours a month, with the groups meeting about once a month. And we're giving a target of most of the groups are hoping to meet by the last week of May or the first week of June. And that the groups would look at their own strategy, develop that together, and sort of provide some quarterly updates on what the group is doing or how they're supporting activities related to PallCHASE. We also anticipate that potentially in the future there would be work streams meaning on a certain topic. An example might be people have expressed an interest in the idea of bereavement in PallCHASE or in humanitarian settings. So maybe there would be a cross-cutting group that would look at that and cut across some of the working groups. So this is the organizational chart for what PallCHASE looks like at this point, just to clarify in your minds. So there's this small executive committee that has been selected, nominated by the meeting we had about a year and a bit ago to determine the way forward for PallCHASE. Then these are the 6 working groups, and I'll go through them in the next slides, 1 slide for each group to tell you what's that group's big idea, because we're going to ask you to invite you to join those groups. So you have to kind of know what they will do. So let's go through these 6 in detail. So education, and they're in no particular order, not even alphabetical, I don't think. So education is the group that's going to be chaired by Catherine and I to start with. And again, it doesn't have to be the exec who co-chairs the group, but just to get things going, we've identified an exec member who will support the group and start chairing it. But again, it can rotate through members. So it's pretty clear what education would do. We're going to identify and support the development of education requirements, education materials that would be related. We've mentioned about that there being a lot of already existing materials and how well those will function for humanitarian palliative care settings. Many people have approached us, and historically PallCHASE has enabled palliative care specialists or people who have expertise in the field to train healthcare providers. Many of you have trained healthcare providers in Cox's Bazar, either in person or virtually. So that might be something that the education group does. And again, they'll support the provision of education and potentially the evaluation or research around education where required. And I won't go through all of this. We circulated this to you ahead of time, and it's a resource and a reference. And when we ask you to volunteer for the groups that you would want to join, potentially, you can review this in detail to see if this fits with what you might be interested to do. Research will be chaired by Moira and Richard, and this group will identify and disseminate opportunities to research or to look at research funding and research partnerships, maintain a list of publications, and develop collaborating relationships related to research. As you can see, we've developed a collaborating relationship already with the Global Health Academy and the University of Edinburgh, but future and potentially more relationships in this way. And we get a lot of emails and people asking us to advise them, to connect them, to support them, typically when they're young and they're new researchers and they're interested in this field. So this would give a direct way for those people to be connected and receive that support. Communications is a really big activity and area that Joan will chair, and this will involve activities like updating our website, developing social media. We now have our Twitter handle, our website, which you'll see launched very shortly. We have a Facebook page. All of these things need some maintenance and somebody to watch them, and we also have the idea of having a newsletter and mapping the services that are available. Joan gave that list of all the countries where we are aware that there are some palliative care activities happening in humanitarian settings, but that will evolve and change over time, and connecting people into local activities is important for them. Similarly, we have an advocacy group, which will be chaired by Joan and Rachel. And Rachel was previously one of our executives and is very interested in this area. And so this will allow us to continue the activities that we're doing in the field of advocating for humanitarian palliative care globally, working with all of our partners and also all of the other global palliative care advocacy groups. So this is a bit of that idea. And then we have networking, which will be chaired by Rick. And this is really important because we see PallCHASE as a network. This is the type of organization it is. And I think Rick really emphasized this, but PallCHASE is all of us. It's a group of members. We come together, we do activities together, we share resources, we share ideas, we share knowledge and skills, and we support others. So we have to really maintain and build that network. We have to know who is part of it. You know, that's why we're being a little bit, intense on, having your email address, connecting up with you. So if you aren't receiving communications from us, if you're not getting our emails, it's either because you didn't register for the webinar, in which case you can still go and fill that registration form, and that will allow us to have your contact information. We will not send you in emails unless you agree that it's okay. In that form, it asks you, are you okay with receiving emails from us? And we will not send you too many emails, don't worry. But if you're not getting emails and you filled the registration form, check your junk mail or send us an email at info@pallchase.org so we make sure that we're connected. But as you can see, all of this takes time and energy. So Rick is going to support that activity particularly and build those links and strengthen our partnerships. And there's certain areas where we identify that there's gaps where we don't have a strong amount of connection yet. So we want to explore and expand those. And lastly, we have resource development. And this falls within the big issue that Rick discussed, which is that we don't have some grand source of funding yet. How are we going to continue these activities? I mean, at this point, honestly, we're asking everyone to give a little bit of their time to something they feel very passionate about, if this resonates with you. But we have to develop strategies for how we would continue to build and support the activities of PallCHASE and identify fundraising opportunities and, collaborate with other organizations, develop proposals for funding, etc. So what we have, and we'll post this in the chat, is a link. This is a link to a survey, very short, I promise won't take you more than 5 minutes to fill it out, but where you can indicate which groups you would be interested to be part of. So of those 6 working groups, do you want to be part of 1 or 2? And it just asks you to select the ones you're interested in, and then just give us a very brief amount of information about what you would bring to the group so we get to know you a little bit. So we'll post this link in the chat, and we'd just love it if you would share that information with us. And there is a deadline for this, so you really have to take a decision and fill this within the next 2 weeks so that we can form those working groups, because we think they're like teams, and we want you to feel that you're connected and that you contribute and you're part of a team and a network. And lastly, I just want to highlight again our social media. So here's our email, info@pallchase.org with 2 L's. Everything you should see now has got 2 L's. We've changed away from PallCHASE with 1 L to everything being 2 L's because some of the domains weren't available with 1 L. Someone else already has that domain. Our YouTube channel is pallchase.network. Or sorry, PallCHASE Network. If you search that, you'll find it. And we will be posting all of our webinar videos to that YouTube channel, so you can access them there. We will email you the link to watch them as well. We have our Facebook page, which has been active for a number of years, and we now have our Twitter handle, PallCHASE. So please join us, connect to all these things, and we'd love to continue to connect and have you join our working groups.
Right, Megan, that's great. And you've just reminded me to say thank you to the previous exec members who, for various reasons, aren't part of the exec now, and that includes Richard Powell, we mentioned, Rachel Coughlin, who would love to have been on live with us today, but it's a bit late in Melbourne, and also to Sophie, who's done a lot of work on the comms. Let's switch off slides now. This is now a chance to get your comments, your feedback on suggestions. Do remember you can be involved with our network without being on a working group. So you can still be a member of the network. We'll make that easier when we see the website links, which are coming very, very soon. Sorry, it wasn't launched already by today. so that you can remain a member of the network and engage and involved. You can, and getting information and communication and signing up to do that. And you can also have more of a role in one of the working groups or bringing up ideas for work streams that may be cross-cutting. But I'd like people to maybe write in the chat or to raise their hands if you've got a comment or a question, and then we can invite different people to unmute and to just contribute to what you've been hearing over the last hour and a half. Any suggestions about who would like to go first? I can see that, Christian, you've asked quite a few questions. I feel as though you've been desperate to ask those questions in the last session and then in this session. So Christian, when you start to speak, could you just introduce yourself and try and keep it a little brief and tell us what's the burning thing that you've been wanting to share throughout this time? Thanks, Christian.
Yes. Hello, I'm Christian. I'm a palliative care consultant, German trained, have worked in New Zealand and in Germany, have been doing locums for the past 5 years before medical director position in New Zealand and in Germany. And my main question is, you have those working parties, those working groups. I see clear overlaps between quite a few of them. This is one question. How do you decide where to put what? And the other question I have is, PallCHASE as a group, how do you envisage your impact on the field and on the practical work in the future? That's one of those things that I really would like to know, because I would like to get involved and I don't know exactly how yet. So let's keep it brief.
I like that. So you're wanting us to say, how are we going to measure the impact before we start doing very much? I like that. I think we should be on the research working group, Christian, by the sound of that. Okay. So I think you made some really good points there. And you're right, there is the potential for them overlapping. That's why initially I think they'll be chaired by somebody from the exec who's at least part of those strategy discussions, although we'd like those to open up and be wider. And I'm very well aware, Jenny, you might come in and say something, but people have proposed working streams before, which may well cut across training and research. So thank you for that. And I'm not overly worried if we are overlapping, as long as we're synergistic. If we're all doing the same work, then that's not great. But if there's an impact study that needs to be done on training, then one or other of those groups might look at that. And we also intend to showcase other people's excellent work, so that we're a platform for finding out what's excellent. But what we do, the first job of the research group, I think, is going to be looking at what are the priorities. So doing probably a Delphi study to have a look at that, and to start establishing where we want to go. But some comments. Who would like to make a comment? Jenny, I've kind of invited you without asking you. You had mentioned before about the important areas around grief and bereavement, because you have been part of PallCHASE right from the beginning. Any comments on what we said to date, or ways in which you can see that area, which I know is your expertise and interest area, moving forward?
Well, I think, yeah, thanks, Moira, and everyone else. And I think that's absolutely true, because for me, my initial interest was with, I'd say 100% of humanitarian crises, you're going to have loss. And so that loss leads into, grief and bereavement. So I just see it as cross-cutting throughout anyway. So that remains very much an interest. But this whole process actually also reminds me of very much what we're going through in Zimbabwe at the moment, with integrating palliative care into the main sort of health system. Despite the fact that we've been doing this in Zimbabwe for over 40 years, we still haven't got there. So I'm really conscious of the fact that in countries like Zim and others, where we're struggling to even do palliative care, and then looking specifically at humanitarian crises is quite a core, but it just emphasizes the need for it for me. And then during this integration process, developing working groups, teams like we're doing now in PallCHASE, one of the things that we've just learned in the evaluation of that at the end of the first couple of years is that if your teams do not communicate really well, on hiding to nothing, because the teams, as Christian has just said, they overlap so much. To be integrated, those teams have to integrate themselves. So I really take that point. There's got to be that constant integration and communication for this to work. And I'm really happy if this is another sort of effort to do that. I'd be very happy to be a part of that.
Thanks, Jenny, and some really important issues there. It may well be that what we do is we highlight an important area to many of the working groups, and that becomes a work stream, which is contributed across. And I think grief and loss is such an obvious area for that. I also think the experience we have from fragile settings. I know, sometimes we have a big debate as what's humanitarian, what's not. There's some definitions that come from the humanitarian sector, but fragile settings, I think there's huge amounts in common. And artificially separating them off may not be helpful. In fact, there may be common lessons to learn. Thank you for that. Anyone else that is wanting to raise an issue or make a comment?
Moira, could I perhaps speak to what Christian has been asking about the different working groups and just the synergy between so many of them? Because definitely communications and advocacy, there's a lot of cross-cutting issues there. Resource development, as we've spoken before, the resource development could be looking for a research funding or getting funding to present an educational course, as well as perhaps asking for donations just to cover some basic things as well. So there are a number of cross-cutting issues there, and I think that's a very good point that Christian made. And if you're going to get into communications, you might well be doing some advocacy as well.
Thanks, folks. We had a big debate about, delivering services versus showcasing them. And I think our feeling was to start with showcasing and to really be working through partners and hope those partners would then be on the working groups and be very much engaged. And each webinar will be focusing partners who are on the ground engaged, just as Tasneem did today so brilliantly. And Farzana, I know you're on the call. You were very much involved in that work along with Megan. And also to try and really establish a much stronger dialogue between the humanitarian sector and the palliative care sector. Who would like to make a comment or ask a question next? No volunteers so far.
See, Erin has her hand up.
Erin, sorry, I didn't notice that. Please carry on, Erin.
That's okay. I just have a question in regards to, so I assume nearly everyone on the call has a connection to palliative care. Myself, I don't have a actual connection. I haven't worked in the humanitarian sector yet, but as we desire to shift that, are there opportunities to, so we're trying to train people in the humanitarian sector on palliative care. Are there opportunities for palliative care workers to be trained to be sensitive to what humanitarian issues are, not to just go in saying, you really need to learn what we know, compared to can we learn what you know?
Brilliant. I'm going to ask Catherine to respond to that because that's absolutely come up in our discussions. Catherine, do you want to say something to that? Oh, Catherine's frozen, in which case I'll pass on to Megan, who's also in the training and education group.
Yeah, I think it's a big question, Erin, and it comes back to sort of a really strong collaborative relationship that I think one thing we've identified as a bit of an area for growth for PallCHASE is to build into the humanitarian sector a stronger working relationship and draw in more partners so that we co-create these educational opportunities, courses, modules, whatever that meet both of those needs. And it's really working well, we find, to sort of have a sharing of knowledge, that we bring together people from these two different sectors. We bring together health workers in the humanitarian sector, palliative care physicians and experts and nurses and counselors from diverse settings, and that they join up together, they listen, they link, and there's a sharing of ideas. And that's what's creating at this point. What is it that is humanitarian palliative care? How do you actually take palliative care that we know as experts or as clinicians and transfer that and build that into what can be delivered and what is possible and what works and respects the situation and the people in these conflicts? And that's, I think, also unique to each setting that you work in, because the settings that Joan listed and that we know around the world are so diverse. The education of the populations that are needing palliative care is vastly different, and all these things impact on how we're going to deliver palliative care or develop palliative care with them.
Erin, there is need for both sides for sure. This is not about one side having all the knowledge and passing it on. This is not about that at all. But actually, there's even someone who's approached us, which is exciting, about doing a piece of PhD work, actually examining what are the educational needs and where are the gaps, which would be another way to link those two areas. I see two. Please do come back in the chat or with another thought, Erin. But let me just ask the two other hands just now to make comments, and then we can, you know, it's not just the exec that can answer the comments. Anybody can. Ruth. I don't know who put it up first, but Ruth, please.
Two things really. I just wonder, I mean, you've done a lot of training, Moira, in northern Uganda, and I just wonder how, if you'd like to just talk a little bit about how you did your training and how you've got the palliative care information and message out there. And also, in response to my earlier question, Stephen said, well, you know, we've got it in the curriculum, but what happens in the curriculum doesn't translate down necessarily, because people working in humanitarian areas are often very different to people working in general hospitals. So, you know, we need to translate this to, I can't remember who it was who said, I mean, it really is simple care, but, you know, hugely effective care. So maybe you can just fill us in a little bit more.
Thanks so much. We may even have Vicky, who was on the previous call, and some of the colleagues from Northern Uganda sharing in our next webinar. But what's been really interesting for me, we've conducted now our second, well, I'm in the middle of our second context analysis, and people are actually seeing the gap. Colleagues in Ministry of Health and government sector and in humanitarian sector. And I think the next question is, how do we meet the gap? And training and education, particularly what I've been so impressed with colleagues working there is, it's focused on healthcare workers, yes, but actually really focused on the community. So VHTs or community health workers and family caregivers. And that last group, in a sense, was a growing area for our area of work, and I think has been really important. So some kind of mobilization role, I think I mentioned that earlier, so that it's not about doing things to people, but actually finding out what's really needed. We're also testing out some tools that might measure some of that experience and impact a little bit in our setting. But thanks for that question. And I'm liking the fact that people are giving us some fairly simple, not simple, but fairly, you know, low-hanging fruit, early ideas here, as well as the whole big picture stuff. Before we maybe respond to some of the things in the chat, Julia, you've patiently had your hand up. Do remember to tell, not everybody will know you. Ruth, you've been working for many, many decades in palliative care in many parts of the world, and part of Palliative Care Works. Julia, just tell us who you are as you ask your question or make your comment.
Thanks, Moira. So I'm Julia. I'm the Chief Executive of the International Children's Palliative Care Network. I'm also a professor in palliative care, and I do a lot of work in Uganda, and been working with Moira and some of the work in northern Uganda and other places. So yeah, it's been listening with interest to the webinar and to this last bit, and it's exciting. I think just a couple of things for me are really key, and that's about integration, integrating palliative care and collaboration, because I think there's quite a few areas where collaboration with other palliative care networks and organisations and with those working in humanitarian settings, that there are only so many of us to go around, and we can't afford to duplicate things. So I think as we work, you know, as that I'm going to be involved in PallCHASE, but as ICPCN also collaborating with PallCHASE, with WHPCA, and really working together, so we're not duplicating resources, and the whole issue of integration. I think we've learnt over the years about the challenges of having parallel structures, and just making sure that palliative care is really integrated into the response in the humanitarian settings. And there's that whole, I think you just mentioned it anyway, but that whole issue around what is a fragile setting and a humanitarian setting. So there's lots of overlap, and so integration and collaboration, I think, are key. Thank you.
Julia, it'd be great to just discuss how we can collaborate even more effectively with the network that I know that you're running with the Children's Network. I see some really good comments here. Saba, you've just made a comment. Do you want to unmute and just tell us the idea you had about getting volunteers involved in some low-hanging research, or some research? Saba, are you still on the call? I can't.
Yes, I am. Hi.
Okay. Tell us who you are, and then tell us your suggestion there.
Hi. Thanks a lot for today. It's extremely exciting to see all the things you're doing. So I'm pretty new to palliative care. I've worked a bit in humanitarian and development. So I joined a little bit like one of the story before after Ebola response. So I'm a strong advocate of what you're doing, even if I don't understand everything. And so there's this few like these small questions that I have that I think could be easy and fast win. Like for example, I was curious to know how much people who are not palliative care experts in humanitarian setting, what are their needs and what do they know about palliative care? And that could be an easy, fast survey to conduct that will push the advocacy and maybe get you money at some point to do a bit more training. So that's the kind of idea. I think I will join the research group after Catherine's comment here.
You're very welcome. You're very welcome. And I think you're right. We need to get a range. We need to showcase people that are doing research. We need to continue to do things together that are going to move the whole agenda forward. And that's a lovely idea. And I think it is really important. We don't just focus on healthcare workers and on people at the top of organizations. We actually have a ground up approach. So thank you for that reminder for that. Okay. And I love all the questions and the comments here about mentorship. Massively important. I think many of us have been involved in programs that if you don't have a component of mentorship, they really don't get integrated and sustained. So thanks for that. Any other comments from those who've been a bit quieter? We just have a few more minutes, so maybe time for 2 more comments, and I think we have to wrap up. Anybody with something burning to say that hasn't a chance to say it yet? No? Well, I think that's session, and please do click on that link, volunteer. I've heard at least 2 people that said they're going to be on the research group. These are to be working groups, just to get involved, get ideas. You can join more than one. Oh, Saba, thank you. You're at Cicely Saunders Institute. That's great. And it'd be great to have, that's another area we'd love to see more engagement. I know there's a really important piece of work at King's College led by Richard looking at war and conflict. So really great to have you on this session today. Okay, so sign up. Get involved and carry on giving us ideas, even if you don't want to be in a working group. I'm going to be sitting in on the training because that's one of my passion areas while helping coordinate research. We really do want your ideas and your comments, and we will be giving you ways to get involved. We're doing some small videos when we're in the field, various of us there, so that we can hear the voices very strongly from those who may not get onto Zoom. May not come. I'll give you a little taster. I interviewed somebody who we trained as a VHT. I think Liz is with us. She was with me, Liz Nabiri. We interviewed him at the side of a road, trained as a village healthcare worker. He got so excited by that. He said it was a stepping stone for him to then nominate himself as a politician. He got elected. Now he wants to take palliative care into his sub-county. So that's a really nice. So we're going to have little videos like that just to tell you, if you like, success stories of what people have done or just experiences that we're really hearing directly from those involved on the ground. But failing that, I think we'll probably bring this session to a close with 6 minutes to go. I'm going to invite to make the final comments. Who shall I invite? John, would you like to just make a couple of comments as we end our session here, and then I might pass to Liz, if that's okay, Liz.
Yes, thank you so much, everyone who's been involved with this webinar and this networking session. I think it's really exciting. We've been doing this for a number of years and moving forward, and I believe this is a really big step in the development of PallCHASE. And please do get involved with our communication, even if you decide not to join us. Join our Facebook page, share our Twitter feeds, because in that way you will help to get the message out, because palliative care is essential in humanitarian crises.
Lovely. Before I move to Liz, I'm going to ask Stephen. Thanks again to everybody who's been behind the scenes on this webinar and has been helping put it together. Stephen, any last comment from you?
No, I think this is just such an important area for palliative care development, and it really is heartening to see so many people on this webinar today, and I want to encourage you to roll up your sleeves. There's such a huge potential for